So for this heart PowerPoint, as we walk through this, you are going to want to make sure that you do have this picture right here. You want the blank one. So the heart diagram that you are going to fill out on your own. This is mine that I put on there for reference purposes. You probably won't be able to read my writing as well. And also, if you do it on your own, then it will definitely help to commit it to memory. Once you do it over and over and over again, then you should have it without any issues. So make sure you do have this piece of paper. You are going to want that as we walk through this particular PowerPoint in regards to the heart. Now, obviously, this system is the cardiovascular system. So we're going to be talking about how this is really going to work to help ensure that oxygen and nutrients are going to all of the cells and tissues in the body, while at the same time picking up any of the carbon dioxide or other waste that the body does not need, and we need to find a way to get it out of the system. So whenever we learn about the cardiovascular system, we're talking about the heart, the blood, and the blood vessels. The heart is going to beat about 100,000 times every single day, and will pump about 8,000 liters of blood per day. So it's busy. It's going to be doing a lot, besides the fact that it is going to be very, very important to nourish all of your cells and tissues in your body. Don't forget, the heart also has to be nourished as well. So there are things that you can do to help with ensuring that your heart can stay a strong pump, and we'll talk a little bit about those things as we go through this PowerPoint. There's different types of blood vessels. So when you think about arteries, instead of thinking about it as red, as a lot of students do, think about it as the word artery starts with the letter A, and A is for away. So whenever you have a vessel that moves away from the heart, that is going to be labeled as an artery. In most places, they are going to be red because they are going to be carrying oxygenated blood. However, there are a few exceptions to the rule. So in order to help you remember that an artery isn't always oxygenated, I want you to remember the A and just remember it always goes away from the heart. Veins, of course, are going to do the opposite. They're going to return blood to the heart. And although most of them are normally deoxygenated, you will see that there are going to be a few exceptions to the rule. Capillaries are going to be our exchange vessels. So these are going to be the smallest areas where you have your actual exchange function occurring. So capillaries are incredibly important, even though they're teeny tiny, because this is where you're going to have the functional workings of exchanging the O2 and the CO2. So the capillaries are very important, even though they are very small, and oftentimes people don't talk about them as much as they talk about things like arteries and veins. When you're looking at the connective tissues of the heart, these are going to help physically support those cardiac muscle fibers, blood vessels, nerves, etc., and then also help distribute the force of contraction. So whenever you look at how the connective tissue is set up, it's not just in a complete circle all the way around the heart. You'll see a picture in a minute. It's more of a figure 8 shape. And so that is, of course, going to in turn affect how that heart is going to contract. It will add strength as well as prevent overexpansion of the heart. There's only so much space within the chest cavity, so we cannot have a heart that gets way too big. Provide elasticity that helps return the heart to the original size and shape after contraction. Just remember, there's going to be so many of these occurring on a daily basis, so we want to make sure that we can always have not just strength and flexibility, but that elasticity that will help it to return back to normal. So here's your cardiac skeleton. When you look at this, this is 4 dense bands of very tough elastic tissue. You can see that this is going to be in that weird figure 8 shape like I just told you about. This will help with stabilizing the positions of the heart valves as well as the ventricular muscle cells. And then it will also electrically insulate the ventricular cells from the atrial cells. That will make a little bit more sense once we go through the cardiac cycle and you learn how the heart beats and you learn about the conduction system. So for right now, just remember it goes in this figure 8 shape because that will help you a little bit later on as we get into the conduction system. When we're talking about the pulmonary circuit, we're going to be talking about how this circuit is the one that will carry blood to and from the gas exchange surfaces of the lungs. So obviously pulmonary, think about lungs, pulmonic structures. Systemic, the whole rest of the body. So everything that is going to and from the rest of the body is going to be our systemic circuit. Each circuit will begin and end at the heart, and the blood will travel through these circuits in sequence. Everything is very systematic and it is set up incredibly precisely. So that's what we're going to learn in the first part, is how does blood travel through all of these different structures of the heart in that very particular sequence. If blood doesn't travel through the heart in that sequence, you are going to have problems in other parts of the body. So that's why this traveling in this direction is incredibly important to learn and to know, because you'll be able to identify where the issues are or what the issues are if the blood is not traveling appropriately. Okay, so here's a picture that you can see here, the difference between the pulmonary circuit and the systemic circuit. If you look at the pulmonary circuit, what you will see is the pulmonary arteries have that blue labeling. Okay, so this is why, or one of the reasons, not the only, but one of the reasons why, do not remember arteries as in specifically red, because it will throw you off once we start doing this. If you remember them only as red, you're going to be a little bit confused and possibly even get things wrong in tests and then on the lab. So make sure that you remember there's that exception to the rule right there. The arteries are going to have deoxygenated blood. The veins will have the oxygenated blood in the pulmonary circuit. And then, of course, in the systemic circuit, it is what you are familiar with, whereas the systemic arteries will be carrying oxygenated blood and systemic veins will be carrying deoxygenated blood. Okay, so get your picture, and you are going to utilize all of the slides through slide 50 in order to draw out, or excuse me, to label on your drawing what all of these different structures are in the heart. So I'm going to have mine here, and I may point to a few structures, but I'm going to go pretty quick. So if you feel like you need to pause this at any point in time, of course, feel free to pause, so that way you can draw things in sufficiently and adequately. When we're talking about the heart, you can see here on this particular picture that I have given you, this is a coronal section, so you can see interiorly into the heart. Not all of our pictures on the PowerPoint will you be able to see that. Some pictures are going to have the entire heart, no sections at all. So just work with those, as well as the other ones that you can see inside. We don't have a back to our heart, so you will see pictures on slides that have a posterior view of the heart, and I'll have you take a few notes in regards to the posterior view as well. So for right now, when we're looking at this, you can see on this particular piece of paper that the heart is not straight up and down. So your heart actually is going to lean a little bit to the left. So whenever you are looking at this picture, then just keep in mind that whenever we are talking about where is the heart, we all know that it's in the chest cavity in the mediastinum area, but the base is going to be around rib 3, and the pointed apex, or this tip down here, this is the apex, this is going to be between ribs 4 and 5. So the base is actually going to be right here, where you will see all of these great vessels connecting, and then this is the apex. Don't let that throw you, because a lot of times you think the apex is going to be the point at the tip, at the very top, just like in your lungs, but that's not the case right here. Okay, the point is pointing down. This will sit between the two pleural cavities. Of course, those are going to be the cavities that surround the lungs. So it's going to sit between the two pleural cavities within that mediastinum area. Here's a picture of it so that you can see where the base is according to the ribs, and then where the apex is according to the ribs as well. Looking at it in the mediastinum, what you can see here is that it's going to be superior to the diaphragm and deep to the sternum. So right here behind this sternal bone, you will have your heart. Now, the pericardium is something that we talked about in 2401 whenever we learned about the different types of membranes in the body. So the pericardium is that serous membrane that is going to surround the heart. So this is just a little bit of a recap and a review. we do have the outer fibrous pericardium and the inner serous pericardium. So whenever I took my picture here, what I did was I just drew like a little line over to the outside and I labeled it pericardium. It's just in this one piece of the heart, but that's because I didn't want to draw it around the entire structure. But keep in mind, it goes around the entire thing. We have that outer parietal layer that's going to be closer to the body wall versus that inner visceral layer that is going to actually be connected to the heart itself. And remember, in between the parietal and the visceral layer, you will have that serous fluid or the pericardial fluid in that pericardial cavity. Very important because that will allow the heart to have a little bit more movement without interfering with other organs nearby, without rubbing up against them and disturbing them. The other thing that fluid sac does, it's a protective mechanism. So if you're ever in a motor vehicle accident and you get slammed either into the steering wheel or into the airbag, it has that protective cushion of fluid around your heart. So hopefully there will be minimal damage, if any damage at all, depending on your accident, of course. And then the movement of viruses, bacteria, things of that nature are slowed because these organs in the thorax are divided by these membranes and these cavities. So if you do have something going on inside of your lungs, the fact that that heart is surrounded by that cavity means that it will take a little bit more time in order for that pathogen to maybe move from the lungs and get over into the heart. So it just kind of keeps everything separate, nice and happy and healthy all by itself. Here's a picture where you can see that difference in that parietal layer versus that visceral layer. And of course, the fist inside of the balloon is showing you the visceral layer would be what actually touches the fist, whereas the parietal layer doesn't touch it at all. That's going to be more around the body wall. And then in between the two, instead of having air inside of the balloon, you would have fluid inside of the pericardial cavity. Here it is whenever you look at this from a superior view, so you can still see the heart, you can see the lungs, you can see the vertebra, so that will allow you to know, okay, that's the posterior aspect. Anteriorly, you can see the sternum. So this is just a different way to view it from a different angle, a different aspect, since everybody learns a little bit differently. Whenever you're looking at the visceral layer of the serous pericardium, this can be called the epicardium. Remember, this is what is going to attach directly to the heart. Do not get that confused with the word endocardium. Anytime you hear that endo, you always want to think indoors. Endo always stays inside. So the endocardium is the actual simple squamous epithelium that is going to be lining the inside of your heart. So on this picture right here, I have it within the right ventricle, and I just wrote endocardium. So that way you could remember endo is indoors. Of course, the myocardium is this thick muscular layer right here. So on your left side of your heart, what you can see over here is that this is going to be much thicker. This myocardium is a lot thicker on the left side of the heart than on the right side of the heart. And we'll talk about why a little bit later. So those are your layers that you're going to want to make sure you know: your pericardium, epicardium, your myocardium, and your endocardium. And then there is a picture for you as well to look at those pieces individually. All right, so you can see here this figure 8, as we see it again, how we have this cardiac muscle tissue forming these figure 8 spirals that are just wrapping around the heart. Okay, this wrapping around this heart in this figure 8 pattern is going to be reflected again whenever we talk about how the heart beats and the contractions that occur in order to move the blood around the different parts of the heart, which is what we are going to go into. Before we get there, pericarditis, and remember, anything itis means inflammation. So pericarditis is inflammation of those pericardial surfaces. They can start to rub together and this can definitely cause some restriction in the movement of the heart. We would call this cardiac tamponade because of this pericarditis. So this is caused by varying levels of pathogens. Again, making sure that that heart is healthy and well and protected is going to be a very important component to understanding this cardiovascular system. There's a lot of things that can go wrong. So whatever you can do to help yourself is going to be beneficial. Inflammation is, long-term inflammation is going to be damaging to multiple parts of the body, not just the heart. So this is why you want to eat anti-inflammatory foods, lots of bright colored foods, lots of fresh, healthy produce, making sure that you're giving your heart lots of nutrients that it needs, and keeping those inflammation levels down is always going to be beneficial for your whole body, not just your heart. Okay, so on the anatomy of the heart, at the very top portion up here near the base, you have two chambers that are going to be called your atria. So these atria are each going to have an expandable outer structure called an auricle, which you do not see on this particular paper right here. The sulci are going to be grooves within the heart. So these are going to contain fat and blood vessels. There's a couple of different sulci that are going to divide different structures, and you'll see those as we walk through the pictures in the PowerPoint. So right here, you're looking at the anterior view of the heart. You can see the right atrium is covered by that right auricle. We don't have that on our paper because we have this coronal section here, but the auricles basically look like, I think they look like puppy dog ears. Maybe you don't think they look like that, but that's just one of the ways that I've always remembered it, is they just look like little puppy dog ears that kind of flap over the top of that chamber on the right and the left side, okay? Looking at the posterior view, again, we don't have that. Your page is just blank on the back. But on the posterior view, there's something very important. So on this particular slide, I do want you to go ahead and circle the coronary sinus, because we're going to be talking about the coronary sinus and its importance in the cardiovascular system. So if you want to go ahead and make a little note right now, just coronary sinus, we're going to come back to that, but we won't be able to see it on this page. Okay, so the four chambers of the heart, I've already said the right and the left atrium. You're going to want to identify those. So how do you know which one is the right and which one is the left? If you didn't have my colored paper to look at. What you want to do is you want to find the two vessels, because the two vessels will be an indication to you that those are going to be on the right side. The two vessels, the superior vena cava and the inferior vena cava, both are going to bring deoxygenated blood into the right atrium. And for that reason, all of those structures are going to be labeled as blue. So get your superior vena cava, your inferior vena cava, and your right atrium completely labeled, and make sure that you are utilizing the blue color, so that way you know this is going to have deoxygenated blood. All right. Whenever you're looking at this particular picture, there is a division between the right atrium and the left atrium, and it is called an interatrial septum. However, it's not really able to be seen on this picture. What you can see is going to be this septum right here. So I have wrote in here septum. This is specifically the interventricular septum. So this is going to separate our right ventricle and our left ventricle. The ventricles are the two chambers that are on the inferior aspect of the heart. So right underneath the right atrium, you can go ahead and write right ventricle. Again, keeping this in blue, because everything that's on the right side of the heart is going to be deoxygenated blood. The AV valves are going to be known as the tricuspid valves and the mitral valves. So these are the valves that are going to allow blood to flow from an atrium into a ventricle. That's why they're called atrioventricular valves. You can call this the right AV valve and the left AV valve. Some books do, but they also have AKAs. So you're going to want to make sure that you do know your AKAs so that you can answer any type of question that is ever thrown your way. So instead of walking through the slides one by one, what I'm going to do is I'm going to take a little moment here to kind of work you through how the blood is going to move through the heart. What I'm going to do is go into the picture that you see here. And in this picture, you can see some of the structures that you're going to want to make sure that you label. So far we already have the SVC and the IVC, the right atrium and the right ventricle. So at this point, go ahead and you're going to make sure that you label this little flap that opens from the atria into the ventricle as the right AV valve, the right atrioventricular valve. This is AKA the tricuspid valve. So that's why I have on my picture here, you can see it says tri and it says RAV. These arrows signify the direction of blood flow. So the blood is going to come from the veins into the right atrium, go from the right atrium down through the valve and get into the right ventricle. From the right ventricle, this blood is then going to turn upwards and go this direction. So what you're going to want to do is you're going to want to, where you see this little circle here, this is the pulmonary semilunar valve. So if you're looking at this on your picture, the pulmonary semilunar valve is the valve that is going to lead into the pulmonary trunk. So label that the pulmonary semilunar valve. This is your pulmonary trunk. This is going to come up. Again, you're still in blue because this is deoxygenated. So from the pulmonary trunk, we're now going to branch off and go out to the right and out to the left. And these branches here, because the vessels that run away from the heart are called arteries, these are our pulmonary arteries. Okay, they are blue because they're carrying deoxygenated blood. Pulmonary arteries. They go to the right and they go to the left. Now, where are they going? They're going to the lungs. So off to the side over here, you can write in to lungs. Okay, I also have it on this side as well. I think, yes, to the lungs. So the pulmonary arteries are going to take blood into the lungs. The whole goal is to drop off carbon dioxide and pick up oxygen whenever we are in the lungs. So that's what's going to happen there. We're going to take that deoxygenated blood into the lungs, drop off the CO2, pick up the O2. Once the blood has picked up the O2, now it's going to come back into the heart. And the way that it comes back into the heart, whether it's from the right lung or whether it's from the left lung, the way that it comes back in is going to be your pulmonary vein. The pulmonary vein is going to be red. So this is your first red structure. You're now going to have to change your color because everything we've talked about up to this point has been deoxygenated. But because we went into the lungs, picked up oxygen, when we come back, so that's my little arrow back away from the lungs and back to the heart, veins always bring blood back into the heart. So these are the pulmonary veins that you can see here that are going to drop blood off in the left atrium. Even if it comes from the right lung, it's still going to drop blood off into the left atrium. Okay, because this is the place where oxygenated blood will go. Oxygenated blood is not ever going to go into the right atrium. Well, physiologically, it should not. Okay, that's not what we want. So whether it's from right lung or left lung, the pulmonary veins on both sides, right and left pulmonary veins, are going to bring it into the left atrium. Once it gets into the left atrium, now we're going to have to go through the left AV valve. So the left AV valve, or AKA mitral valve, AKA bicuspid valve, is going to allow the blood to flow from the atrium and into the ventricle. So this one right here has 3 different names for the exact same structure. It's all the same valve. It's like if I were to be called Mom, Dr. Jones, or Stephanie. It's still all the same person, but I just have 3 different names, okay? So it's still all the same valve, just has 3 different names. Over here, same valve, 2 names. Okay? So once the blood is in the left ventricle, what's going to happen is the blood is going to push back up and it's going to go up towards the aortic semilunar valve. So you have this little circle here, and you can actually see the aortic semilunar valve is going to be going towards the aorta. It's a little bit harder to see on the PowerPoint picture because that aortic valve is kind of hidden behind the pulmonary trunk, but I promise you it is there. So once you have your blood going into the aorta, the very first part of this aorta is known as the ascending aorta. That's because it's going up. So anything that goes up, it ascends. So the ascending aorta is the very first portion. Now, here's where the picture kind of gets a little bit confusing. So make sure that you understand and you know this. What you can see here on my picture is that I've got my aortic semilunar valve, and it's going to come up into the ascending aorta. But I've got this little dot on each side of the ascending aorta with a squiggly line. So you can see the squiggly line here, the squiggly line here. The squiggly lines are representing coronary circulation. So if you look at the squiggly lines off to the side, what you'll see over here, it says LCA, and then off to this side over here, it says RCA. So the LCA and the RCA stand for left coronary artery and right coronary artery. I'm going to put a pin in it right there, and I'm going to come back to that in just a minute because it'll be kind of confusing if I show you from this particular view. I'm going to show you a different view on the PowerPoint slide that's a little bit further along. So put a pin in that. We'll come back to that. Your blood will continue to travel up the ascending aorta and get into the aortic arch. As the arch turns, now it's going to come down. So of course the word for down is going to be descending. So this is going to turn into the descending aorta. This can also be known as the thoracic aorta. So that's what you see on this piece right here, because the aorta has gone down behind the posterior aspect of the heart. And now this little piece you can see, whereas you couldn't see the rest of the descending aorta. The thoracic aorta or descending aorta is going to change names once you hit the diaphragm. Once you hit the diaphragm, that's what these notes are down here, it's going to change its name into abdominal aorta. And then once you hit L4, it's going to become the common iliac artery. So it's one really long vessel, but it's all named according to the direction, either ascending or descending or arch, or where it's at. Is it behind the thorax? Is it past the diaphragm? If so, we'll call it abdominal. Is it all the way down in the pelvic area? If so, then we're going to change the name to common iliac. As you learn blood vessels, one of the things that's difficult is that there are so many names, and that's because things will change name as it comes closer to another structure. So it's very important to make sure that you kind of keep all of your names straight, but of course, essential that you understand landmarks. That is what is going to really help you and pretty much save you whenever it comes to the blood vessels, is paying attention to landmarks, because they usually are going to be named according to the various landmarks. That's why we have the axillary artery. So that's armpit area. That's why we have the brachial artery in the arm. That's why we have the subclavian, clavicle underneath, subclavian. That's where a lot of the names come from. So if you just pay attention to what you're looking at, it will be a whole lot easier for you to know what that particular vessel is called. Okay, so let's go through this again. I want to make sure that you can completely get this blood from the very beginning all the way to the very end. Now keep in mind, even though I'm breaking it down like this in a simplistic manner, both sides will always have blood at the same time. It's not like you're going to have all deoxygenated blood over here and you have to wait for some oxygenated blood to come over here. This is a double pump, so both sides are going to be working at the same time, and you'll always have blood moving in both sides concurrently. So I'm just breaking it down to make it very easy for you to learn, but just keep that in mind as we go further into the PowerPoint that both sides are going to have blood in them. Okay, so up here in the top corner, what you have is that it says there are 3 ways for deoxygenated blood to get into the right atrium. 3 ways you always want to remember: SVC, IVC, and coronary sinus. Remember earlier, whenever we looked at the posterior view, we circled the coronary sinus, or you circled the coronary sinus. So that coronary sinus is going to take blood into the right atrium, just like this SVC and this IVC. On this particular picture right here, you can see there is a little structure that is labeled the opening of the coronary sinus. So you definitely want to remember that that is also going to drain blood into the right atrium. So SVC, IVC, and coronary sinus allow blood to get into the right atrium. This is deoxygenated blood. SVC, IVC, and then posteriorly coronary sinus all put deoxygenated blood into the right atrium. From the right atrium, we move through the right AV valve, aka tricuspid valve, in order to get into the right ventricle. Once we're in the right ventricle, then the blood is going to push up superiorly to get into the pulmonary semilunar valve. Once it's in the pulmonary semilunar valve, it will get into the pulmonary trunk and then split off to go into the right and left pulmonary arteries away from the heart. All of that is blue because all of that is going to be carrying deoxygenated blood to the lungs. Once the blood has dropped off the CO2 and picked up the O2, that oxygenated blood is going to come back into the heart through the pulmonary veins. Those pulmonary veins will always drop the oxygenated blood off in the left atrium. From the left atrium, you will go through the left AV valve, aka bicuspid, aka mitral, in order to get into the left ventricle. From the left ventricle, the blood is going to push back up superiorly into the aortic semilunar valve. From the aortic semilunar valve, go into the ascending aorta, go into the aortic arch, descending, aka thoracic aorta, and then down past the diaphragm, we'll call it the abdominal aorta. At L4, we'll call it the common iliac artery. So that is how blood is going to flow through. If you need to pause right here and go through it a couple more times, then I highly encourage you to do that. Whenever you are getting ready to take your test, you want to make sure that you can identify all of the different steps that the blood is going to take, all of the different structures that it has to go through, so that way you're ready for any questions that could come your way in regards to that. But you also have to know that in order to efficiently understand what's happening in the cardiac cycle. So the cardiac cycle is part 2 of this PowerPoint. That's where you'll have those 5 videos that you can look at for that information. But that will be kind of hard for you to understand and learn if you do not know how the blood is flowing through the heart. Okay, so get this first. This is step 1. You have to have this down before you can successfully move forward. A couple of other things that I want to talk about before we leave off of this slide that you do not see on my picture, but of course you're welcome to put on your picture, is the chordae tendineae and the papillary muscles. So on your right and left AV valves, these right and left AV valves, you can see on this PowerPoint slide that there are these little white lines called chordae tendineae. Those connect to the papillary muscles. Those ensure that whenever it's time for those particular valves to stay closed, that they do stay closed. So those are pretty important structures. What you do see on my picture is the moderator band, which is going to be in the right ventricle only. So make sure you go ahead and draw in the moderator band, because we'll be talking about that later on when we talk about the conduction system. And then you have different muscles within the atria versus the ventricles. The muscles in the atria are called pectinate muscles, and then the muscles in the ventricles are called trabecular coronate. So you can draw those in if you want to. You don't have to, but those are just some additional structures that you can add on there if you wanted to do that. Okay? All right, so there's a real heart. You would normally be doing a dissection in lab with an actual heart, but now you're just going to have to kind of look at some of the pictures to see what that heart would look like as a dissection specimen. Looks very different from a pretty color-coded drawing. Okay, so let's go into this slide because I have a little question over here, regurgitation. What is it? Answer this. Regurgitation is going to be backflow of blood. Anytime you look at valves, we just talked about 4 different valves within the heart. The valves are for one-way blood flow. The one-way blood flow is going to be vitally important to nourishing the rest of the body. What we don't want is blood flowing backwards. And if blood flows backwards, then that's whenever we get what is called regurgitation. So that could be a problem that is indicated with one of the valves if we can hear regurgitation whenever we are listening to heart sounds with the stethoscope. Okay. Lots of different pictures. Here's where I want to go. Let's talk about the coronary circulation because I told you to put a pin in it as we were here in the ascending aorta with our little dot and our squiggly line, the RCA and the LCA. This is incredibly important because this is going to be what supplies blood to the actual muscle tissue of the heart itself. Blood is being supplied to the rest of the body by the heart, but the heart still needs its own blood too in order to get plenty of oxygen, in order to get plenty of nutrients, and then of course to eliminate waste. It's vitally important that the heart get fresh, healthy blood as well. So the way it does this is through the coronary circulation. The coronary arteries are what you have labeled on your picture as the RCA and the LCA. So the heart is actually going to get first dibs on freshly oxygenated blood. So if you look here, back at this heart again, remember as the blood flows through the aortic semilunar valve, it gets into the ascending aorta. The first vessels off of the ascending aorta are the right and the left coronary arteries. That means that the right and the left coronary arteries can take fresh, healthy blood directly to this myocardium so that the heart can continue to be a good, strong pump for you. So this just represents, the squiggly lines represents that heart gets first dibs on that freshly oxygenated blood. As the blood continues to move up into the aorta, now you can see that we have these 3 structures here that are going to be labeled as well. So you want to make sure that you label these 3 different structures so that you know where the blood is going to flow to as it leaves the arch of the aorta and gets out into the body. The first one that you can see here, my writing is probably not so great, but this says brachiocephalic, brachiocephalic. And what I've done is I've drawn for you on here that this is going to bifurcate or divide into 2 different vessels, and those 2 vessels you want to label as well. Okay, so first thing off of the arch is the brachiocephalic. Brachiocephalic is going to divide into the right subclavian and then the right common carotid. So we're over here, this is the right side of the heart. This is going to take blood to the right arm and to the right side of the head. If we move on to the second structure, this is the left common carotid, and then the third is the left subclavian. So that's how you're going to get blood over to the left side of the head and then towards the left arm. Now, one way to remember this is ABCs. A, B, C, apostrophe S. You can write that up here if you want to. The ABCs stands for aorta, brachiocephalic, C for common carotid, and S for subclavian. ABCs. That's how you can keep those structures separate and kind of help memorize them, especially helpful for whenever you are in practical, right? So there's going to be so many different things you have to memorize. That's a very easy way to do these first few vessels that are going to be coming off of the heart as the ABCs. Okay, so right coronary artery is going to give blood to the right atrium, and then portions of both of the ventricles as well as portions of the electrical conducting system of the heart. We'll be talking about what the electrical conducting system of the heart is in the second part of this PowerPoint. It will break off into the marginal artery and the posterior interventricular artery, so it's going to bifurcate into these other arteries. As you can see, I don't have that all drawn on this heart because drawing too many structures is going to make it very busy and hard to read. So just know that that is going to go into other structures. The left coronary artery, same thing. It's also going to give rise to other arteries as well. So this is going to supply blood to the left ventricle, left atrium, and then the interventricular septum. Remember, septum means wall. So that's this area right here in between the two ventricles. So left coronary artery is supplying blood all right here. If we have an arterial anastomosis, this is basically going to be a structure that will interconnect the anterior and posterior interventricular arteries. This is to help maintain a very constant blood supply to that myocardium. So if you think about a lack of blood supply going to the myocardium, how damaging that could be to the heart, what we don't want is we don't want any interference. So the anastomosis will help ensure that we have this constant blood supply to that cardiac muscle. Now for the veins, remember whenever we looked at the posterior aspect of the heart, we saw the coronary sinus. So that structure is going to come up here in just a second. What happens is that whenever the coronary arteries give blood to the actual myocardium, ultimately that blood is going to be utilized, and now we're going to have wastes that are going to need to be eliminated. So the cardiac veins are going to drain the used blood off of the heart, and they will return the blood to the coronary sinus. Whenever those veins drain the blood off of the heart and move it into the coronary sinus, remember the coronary sinus can then move that deoxygenated blood over into the right atrium. So that's why that's important to remember, that whenever you're getting blood from, let's say, the head, to go deoxygenated blood to go from the head into the heart is going to have to go through the SVC. Deoxygenated blood from the pelvic cavity is going to have to go from the pelvic cavity to the heart through the IVC. But if we're talking about coronary circulation in and of itself, then that blood from the heart is going to have to go through the coronary sinus and then get into the right atrium. Now, you can have some anterior cardiac veins that will empty into the right atrium, but for the most part, people always remember a coronary sinus will help drain the actual coronary circulation in order to return that deoxygenated blood back into the right atrium so that it can go through its cycle all over again. Okay, so here is a picture where you can actually see your right and your left coronary artery coming from that ascending aorta. So look there at that picture, and you can see the RCA, the LCA at the very, very beginning of that ascending aorta, because again, remember, myocardium gets first dibs on freshly oxygenated, healthy blood. So before everything goes out into the rest of the system, let's ensure that the heart is purely oxygenated, lots of nutrition, so that it can continue to pump all of the blood everywhere else like it's supposed to. And again, there's your coronary sinus, where you can see how all of that waste can drain through the veins, get into the coronary sinus to get back into that right atrium. And there's another picture. Okay, so when we're talking about coronary artery disease, we're talking about areas of partial or complete blockage of that coronary circulation. So if we're talking about some blockage that's going to occur in the RCA or the LCA or any of the other smaller arteries that branch from the RCA and the LCA, that's whenever we're talking about coronary artery disease. Remember, the cardiac muscle cells have to have that constant supply of oxygen and nutrients so that it can continue to pump, because that's your heart's job, is to be a pump so that it constantly is pumping fresh blood all around your body. If it does not do that, then it's not just your heart that's going to suffer. Of course, it's going to be the rest of your body that's going to suffer as well. Coronary ischemia is reduced circulatory supply from the partial or complete blockage of those coronary arteries. If you look at this particular picture, what you're seeing is what's called a digital subtraction angiography. On the normal heart versus the advanced CAD or CAD, you can see that there is a stark difference between how thick those arteries are and how much blood flow is occurring within those arteries. So this is very easy, even if you have no medical experience, it's very easy to see the difference between the two pictures. And it's obviously going to be a problem if somebody does not have the ability to get blood to flow into their myocardium so their heart can continue to pump adequately. Coronary artery disease, usual cause is formation of a fatty deposit, or what we would call an atherosclerotic plaque within the wall of the vessel. The plaque, or if it's a clot that's attached to the wall, is called a thrombus. This can cause a narrowing within the artery and then reduce blood flow. And if there's spasms that occur within the smooth muscles of the vessel, then of course this can further cause that narrowing, which can then definitely impede or impact the flow of blood. Now, most people, whenever we start talking about atherosclerotic plaques, most people will say, oh yeah, this is why you shouldn't have high levels of cholesterol. But I'm going to go ahead and stop you right there and tell you that there are a number of different studies that have been done that show that really the levels of cholesterol do not adequately show who is or who is not going to have issues with heart attack or strokes due to the impedance of blood flow within their vessels. So it's very important to understand this on a level of physiology that you can then make sure you utilize the information for yourself, for your family, friends, people whom you love, and get people to understand how this actually works. So let's look at this for a second. Here's your normal artery. Here's the narrowing of the artery due to the atherosclerotic plaque. When we go through the PowerPoint on blood, what you are going to see is that when there is a clot, there is a normal process that will help dissolve the clot. Okay, that is within physiology. If a clot is formed, then it's usually formed because there is some sort of damage that is being done to the vessel. And so it's kind of like putting spackling on a wall that has been damaged by somebody punching a hole in it. You do not want your vessels to have holes in them. You do not want them to allow blood to get out of the vessel. So a clot can form in order to help cut off a problematic situation where that person could hemorrhage out. So the clot will form right there, and as the clot does its job in helping to repair the vessel wall, there is a process where that clot is going to naturally, physiologically dissolve and go away. The problem is that whenever people don't know that they have these clots inside, or they don't know how the things that they do on a regular basis can impact the health of their vessels, that's where some of the issues arise. So although cholesterol has been implicated very harshly in creating these clots, in actuality, what's happening is you're looking at a situation where the vessels are, for whatever reason, there's different reasons, being destroyed internally, and cholesterol is coming in and trying to help kind of pack up that, like that plaster on the wall, trying to help clear up that problematic area and resolve the issue. So because cholesterol has been in the area, then of course it's been the one that's gone under the gun as, you know, this is terrible, let's get this out of here, when actually it's all working together to try to help you, okay? So what can you do then if it's not cholesterol levels that are always the issue? A couple of things. Let's go back to that slide. Here we go. Be proactive. So of course, stop smoking. Why? Because the toxins that are in smoke are going to destroy the lining of those vessels. And as you start to destroy the lining of the vessels, then your body is smart and it'll say, this person's destroying, let me fix. And so as it's trying to fix, then this is where you're going to get those clots that are occurring. So you've got to stop smoking. Definitely have to address high blood pressure. There's different reasons for high blood pressure. Sometimes it's a stress issue. Sometimes it's a food issue. Sometimes it's a weight issue. It really just depends. So you really need to address whatever the underlying cause is of the blood pressure in order to stop making your vessels work so hard, okay? Adjust the diet to lower glucose, sugar, and nourish with heart-healthy foods like berries, avocados, nuts, fish, leafy greens, etc. There's a lot of heart-healthy foods. It's very easy to do a very quick Google search, what are heart-healthy foods, and come up with 25 different things that you should be eating on a regular basis. If you look there, the reason why that glucose is in red and why it's italicized is because the book says adjust the diet to lower cholesterol, when in fact that hasn't always proved to be helpful. So people are so busy thinking, oh, it's the cholesterol, it's the cholesterol, it's the cholesterol. They lower the cholesterol, they still have a heart attack. Why? Because glucose can tear up those arterial walls like nothing else. Think about it like if you've ever been scratched by a cat. If you've ever been scratched by a cat, then you know that sometimes it goes pretty deep and sometimes it happens so fast you didn't even see it coming. The more that glucose is in your bloodstream, the more cat scratch you're going to get on the walls of your vessels. And so now your body is going to try to repair and try to replaster those walls so that you don't bleed out. As we go through the blood vessel PowerPoint, I'm going to talk more about this, and I'm going to show you some articles that talk about how this actually happens. So for right now, just kind of go with me, trust me on this. You've got to be more concerned about sugar levels than you are about the cholesterol levels, because 50% of people who have heart attacks, normal cholesterol, 50% higher cholesterol. There's been no actual definitive studies that were not biased and or incorrectly done that show that there is a need to drastically lower cholesterol levels to the levels at which people now currently recommend. It's unfortunate, but that's the way that it is. Reduce stress, increase physical activity, increase water consumption, because your blood is made up of plasma and formed elements. We will learn this in the blood PowerPoint, but 90% of plasma is water. You've got to have plenty of water in your diet on a daily basis to help your body function as it's supposed to. So if you do not know how much water you're supposed to be drinking, let me tell you the formula. You want to take your body weight and you divide it by 2. Once you take your body weight and you divide it by 2, that number that you get as your answer is how many ounces of water you should drink every day. So I weigh 110 pounds, 55 is my number. If somebody else weighs 200, 100 is their number. So it's important that that is your minimum, not maximum. That's your minimum every single day in order to help your body do what it is created to do. Go through normal cellular metabolism, go through the normal physiological aspects that it's supposed to go through, half your body weight in ounces every day. More if you smoke, more if you drink, more if you exercise, more if you sweat profusely because it's really hot outside. If you go outside for a run or to do anything and you're sweating excessively, then you need to drink more. If you're a coffee drinker, you need to drink more. If you drink lots of beer, you need to drink more water, because anything that causes you to lose water, you're going to need to replace that. So very important to know how much water you're losing in regards to how much water do you need to regain. Okay, and then in this PowerPoint, I also have some little blanks here in purple because these are better indicators of heart health than cholesterol levels are. So what you want to do is you can fill this in. Basically, homocysteine is the first one. CRP is the second one. And then BNP is going to be the third one. So homocysteine, CRP, and BNP are going to be levels that are going to be better indicators on blood labs than cholesterol levels. If somebody comes to me because they've got their blood labs and their cholesterol numbers come back abnormal, my first inclination when I see high cholesterol levels is to think, okay, this person obviously has some issues going on where there's going to need to be some repair in the circulatory system somewhere. Or if that person has any type of inflammatory disease, like if they have diverticulitis or Crohn's disease or anything that would cause them to have high inflammation, RA, things like that, I expect those people to have higher cholesterol levels straight out the gate because the cholesterol will be there to kind of be like a repair mechanism. So just stuffing down those cholesterol levels just to get a number that looks good on a lab test isn't always going to be beneficial whenever you're looking at the patient as a whole, because you might be taking away part of their repair process. So if their cholesterol levels do come back high, then what I like to say is go get an ultrasound scan of your carotids. Go get your carotid scanned. You can scan other arteries as well, but let's just see how much plaquing you have, because that's really what matters. I've had patients who have had their cholesterol levels into the 300, but they don't have that plaquing. So it's very important to treat each individual based upon their health and their case, not necessarily based upon what everybody thinks should happen with a person who has high cholesterol levels. You got to kind of get into the detective mode and figure out a little bit more in regards to that particular person, because there are so many side effects that come along with statin drugs, and that isn't always the answer for everybody. Some people, that may be what they want to do, but that's not everybody. I also put on here red meat, dairy, coffee, smoking, alcohol. Those will raise homocysteine levels. So if you do see that high on somebody's blood labs, and let's say they are on the keto diet, then that could be a possibility as to why. But I put the little star asterisk because although people will say, oh, those are, things that are not good for you, those are super unhealthy. If you look again at individual products instead of grouping everything all as one, because that person who has the cows on their farm and they're taking care of their cows as cows should be taken care of, they're allowing them to eat grass and allow them to go outside and live like a normal cow, versus that person who has thousands of cows stuck inside a building and the cow eats grain all day and gets injected with lots of antibiotics and lots of hormones, and those are going to be two totally different animals. Whenever you look at the actual components of the meat that you could be eating. Whenever you say all red meat is bad, you're missing out on the fact that if an animal is grown in a different environment and or given different opportunities for feed, then we're looking at two different forms of meat. So we can't say, oh, this is all bad, okay? There are some good benefits to red meat if you're eating a healthy, high quality red meat. Same thing with dairy. So, and then with coffee, Let me just say really quickly in regards to coffee, there's been so many studies that go back and forth between coffee is bad, coffee is good, coffee is bad, coffee is good. But again, that's where you kind of got to figure out what exactly are they looking at? Are they looking at a coffee that is organically grown, or are they looking at one that has just been covered in pesticides? Because can you really honestly say that this stuff that has been covered in pesticides is going to be healthy for a human being? And no, you can't say that. Whereas this stuff over here that's grown without the use of the pesticides, if it has some beneficial factors to it, are those factors lost if you spray it like crazy with this poisonous chemical? So again, it's really about using your brain, thinking a little bit deeper, looking a little bit deeper into things rather than just believing everything that you hear. So coffee is okay. Black coffee is best, not with cream and all of the other poisonous chemicals that come with all of the crap that you put in them from all of those different creamer companies. Okay, so that is one thing that you want to think about whenever you're thinking about the heart, whenever you're thinking about how to address the heart. This is one of the reasons why people who, whenever they do things like keto and they do eat a lot of fats, why their cholesterol levels can come down and while their homocysteine levels can come down, because it really comes down to what was the reason why the cholesterol was high in the first place. Is it because you had a lot of inflammation? So if you took out all of the sugar out of your diet, which you do have to do on keto, now you release the sugar. Now the cholesterol can naturally come down all by itself because it doesn't have to do all those repair things because you're not killing the inside of your arterial vessels. So not everybody does well with keto because not everybody has a sufficient gallbladder. That's a completely different story. So that's digestive system. So not everybody should do every type of diet. Again, you got to focus on what does this person need and what's going to work best for their physiology with the way that it's working right now. And that takes some time and some learning. Okay, let's go backwards. As we go backwards into this, if you do have that narrowed artery because you're not taking care of yourself, you're either smoking, living a very sedentary lifestyle, not drinking enough water, so you're super dehydrated, not eating healthy foods at all because you choose a bag of Cheetos and a box of Cheez-Its every single day with a side of Twinkies, whatever, I don't know. If you're doing all of these things and you're hurting your insides, then it is going to catch up with you without a shadow of a doubt. So if this artery becomes completely blocked and you cannot have any flow coming through, then you can start to get symptoms of either angina or a full-blown heart attack. So angina is commonly one of the first symptoms of coronary artery disease. So this is when you may start to feel some pain or some pressure whenever you are doing something where you're having to exert yourself, whether that's working out or whether you're in a physically demanding job with manual labor. If you start to feel some of the chest pain, some pressure, shortness of breath, things like that, and especially if the pain starts to radiate down to the left arm or up the neck into the head, these are all symptoms of angina. It's telling you that something is wrong, that there is an issue there. I actually just a few weeks ago spoke to a 40-year-old male, looks stellar on the outside, stellar, completely muscular, totally like pinnacle of Muscle Magazine fitness, like looks great, right? So anybody would look at this male and say, oh, he's healthy, when in fact, what he was talking to me about was angina. He didn't know it was angina, he just knew that there was a problem. So whenever he went through all of his symptoms, I said, it's angina, you've got something going on in your circulatory system. The fact that you look great doesn't necessarily mean that you are healthy on the inside, okay? So don't let people like that fool you, because the outside can be a misrepresentation of what's going on the inside. We've got to look at all factors involved, not just one or just some things. Sometimes the outside does a really good job of letting us know. We can see it in skin color with high blood pressure. These people, their face will be very red, very ruddy. Even if it's wintertime and they look kind of like they're sunburned, that is one of the signs of a high blood pressure problem. Or if that person is really white and ghostly pale, that could be a sign of anemia. So they're having some blood issues there as well. So we've got to look at all things and not just limit ourselves to what we see, because maybe that ruddy red complexion, maybe they went to Colorado and they went skiing and they did get a sunburn. So got to consider all things. An actual heart attack is called a myocardial infarction. This is whenever that coronary circulation does become blocked and the cardiac muscle cells die from lack of oxygen. So there is no oxygen that is going into those cells. They will die, and that death of that tissue will create a non-functional, circle that, non-functional area known as an infarct. That infarct is no longer going to provide the normal physiology that you would expect from your heart. So if it is a large portion that has died, then a large portion of your heart is no longer going to work like it's supposed to. Why is that important? Because heart disease is known as the silent killer. It can show up at any point in time. And one of the most common side effects is death. Now, if you think about that, if we have a very common side effect, meaning death, that means I don't get a second chance once the symptom shows up. So as the silent killer, you have to keep in mind that the best thing to do for your heart is to be proactive. You don't ever want to be reactive whenever it comes to your heart. You want to address these things early on so that you don't have to worry about what may come later on down the road, because it could surprise you. It could totally surprise you. Just like the guy with the pinnacle of fitness that I was talking about just a second ago. It was very surprising to both him and his wife that that is what he was dealing with. That being said, I also want to say about this guy, mostly vegetarian, no red meat at all, does not eat red meat, cannot do dairy because he's lactose intolerant. And so if you were thinking, oh, well, maybe he's eating lots of really bad foods, so even though he works out and he's physically fit, if he's eating unhealthy foods, that's not it. But what he does eat a lot of, cereal, lots of sugar, loaded cereals, and lots of sweets. Love sweets. So again, that goes back to decrease that glucose, because that glucose will cat scratch out those vessels and really cause you problems. Okay, so back to where we're at. If a piece of the heart dies, cardiac muscle cells do not come back. If you change the structure of something, you will change the function. So if you change the structure of your heart because you now have dead tissue, then the function is not going to be the same either. So this again is why it's imperative to be proactive with heart health, because once it's dead, that's it. Honey, it's dead. Okay, no coming back from that. It's not Lazarus, it's just dead. All right, so coronary thrombosis is a thrombus formation as a plaque, most common cause of a myocardial infarction. So got to keep those things healthy and keep that blood flowing through like it's supposed to. This is just a picture to show you that occluded coronary artery. So you can kind of see that blown up structure where that blood cannot get through and get to that myocardium to supply it with the oxygen and nutrients that it needs. Consequences of an MI depend on the site and the amount of blockage. So if you think about it, if it's near the very beginning of one of the coronary arteries, so if you look at your picture and let's say that there's a blockage like right here, then that's going to be significant, because that means that everything from that site forward is going to be impacted. So that is going to be widespread damage. However, if it's one of the little small, tiny branches that has branched off of the main branch, either the RCA or the LCA, then the damage is going to be less, because it was one of the smaller, tiny pieces that maybe just went to a smaller section of the heart instead of a very large piece. Okay, so if that blockage involves a small arterial branch, then it's possible to survive. that immediate crisis, but you can still have complications if those cells do die and become an infarct because they will not function like they're supposed to anymore. An MI can cause very intense pain, but not always. Not everybody feels the pain, so it is possible for this to go undiagnosed and untreated. It is possible for people to have a heart attack and then later on, a few years later, go to the doctor and they're like, I think I'm having a heart attack, do tests, figure out, oh yeah, indeed you were. And by the way, you have had some other heart attacks in the past. Do you want to tell us about that? And they're just completely surprised. Like, what? I had no idea. So whether it's heart attacks or strokes or things like that, it is possible to see that these things have gone undiagnosed and untreated whenever people come in with larger MIs. So you often use an ECG as well as blood studies. The ECG we will talk about in another section. The damaged myocardial cells will release enzymes into circulation. You see some of them there, and that's one of the reasons why you can use the blood studies in order to diagnose if someone has an MI. Treatment, so 25% of these patients will die before they get medical assistance. 65% of these deaths will be in people under age 50 within an hour. So that is a huge statistic. It's kind of hard to swallow, but if you think about it, there are lots of things that can be done to prevent this. So really it is just about educating yourself, educating those around you, and doing all that you can in order to keep that heart as healthy as possible so that you don't become a statistic. Now, MI is not the only form of heart disease. There's also sudden cardiac death, SCD. So this is sudden and unexpected due to a change in heart rhythm. So this is not necessarily a blockage within the coronary circulation, but this is a problem with the conduction system that's going to then affect the heart rhythm. So each year there are a lot of people who die from sudden cardiac death. It's unfortunate that it also occurs in young kids. Sometimes you see this whenever you have football players who just fall out on the field. So it is a very real deal. Obviously, one of the important reasons for kids to get their school physicals before they get involved in athletics to make sure that everything is working appropriately like it's supposed to. So this is an electrical system problem within the heart, not necessarily a blockage of a vessel within the heart. Okay, so we already talked about that. If you're going to do drug treatments, I'm not going to read all of these, but there is a couple of different things that are there in regards to drug treatments. Aspirin and Coumadin are listed in the book. However, I will tell you as a holistic practitioner that I have seen studies that show that garlic will also be just as helpful in thinning the blood and does not come with all of the negative side effects of the aspirin. Obviously, Coumadin is prescription. A lot of times people take baby aspirin on their own. If I can get people to switch over from baby aspirin and start doing garlic every single day, then it actually helps them in more than one way, not just their circulatory system, but also digestive system and immune system. And aspirin just is not going to provide all of those benefits. So you can look into that. If we block the sympathetic stimulation, different drugs will do that, such as beta blockers, in order to help block the receptors that will cause the heart rate to increase. And we'll talk about sympathetic stimulation versus parasympathetic a little later on. Drug treatments that can cause vasodilation, such as nitro, or those that block calcium ion movements, calcium channel blockers, different things that are available, again, depending upon the patient, depending upon other factors in regards to their health as well. Non-invasive surgery, there's a couple of different things that you can do, so I will let you read through those things, as well as grafts. So grafts can be utilizing one vessel in order to kind of create a opportunity for blood to flow around any obstructed portion of the coronary artery. So it's basically just a detour. You can do up to 4 of these. That's why there are different surgeries that will be labeled double bypass or quadruple bypass. Really just depends upon how bad the circulatory system is inside of that patient's heart as to what they are going to need. So in being proactive, of course, let's make sure that we do have a good cardiovascular exercise, because this cardiovascular exercise is going to help strengthen your heart. It's going to help ensure that oxygen is going to be delivered efficiently. So making that circulatory system work is going to be beneficial to you long term. That's why you cannot just sit around all day and expect to have a healthy heart. You've got to work it out. It is a muscle. It is a myocardium. That means muscle. So that muscle does need to be worked out. As you do cardiovascular exercise, it will strengthen your heart, and then it will also help strengthen your lungs. Your heart and your lungs are BFFs. They are going to have to work together in a lot of the things that they do in order to provide you the physiology that you expect on a daily basis. So whenever we get into the respiratory system, you're going to see how imperative it is to understand cardiovascular system in order to understand how the respiratory system works, because not only are they neighbors, they are very, very, very close friends, and the workings of both of them are going to be very important together. Okay. All right, so during cardiovascular exercise, these are the things that are going to occur. Obviously, oxygen demand is going to increase with activity, so that is going to increase coronary blood flow. Lots of different things that are going to be happening during exercise. Exercise is very important, vital. It also is a stressor, so you don't want to overdo it, especially if you just recently got diagnosed with a heart condition. You don't want to just go out there and be a weekend warrior and stress the crap out of your heart. You know, you want to kind of take it a little bit at a time and slowly get your heart acclimated to it if it is not used to that. So don't think that this has to be we're going to go all in tomorrow because we haven't done anything in 20 years. That's going to put a little bit too much stress on your heart. You got to kind of work it up. If you do exercise, then this will help move that LDL cholesterol that everybody calls the bad cholesterol. Really, it's not bad cholesterol. There's no really such thing as good versus bad, because it's all imperative for our body to work as it's supposed to. But that LDL, that lower density that's usually associated with plaquing, exercise will help move that from the blood and put it into the liver. And at the liver, it can then be converted into bile and then excreted out. That's why cholesterol is an important component of your body in regards to your digestive system. But the exercise also will help slow the formation of the plaques themselves, because as you're exercising, then there's a lot of different hormones and a lot of different interactions that are going to be going on inside of your body. But it is something that will allow your body to work more efficiently. So there's a less slow blood flow. As you increase your blood flow, then it's less likely that those plaque formations can happen. Plaque formations are easier to occur if you are dehydrated or sedentary, because your blood is just flowing like sludge and it's so slow. But that doesn't happen in people who exercise regularly. Okay, so of course, cardiovascular exercise is going to reduce the risk of heart attack by almost half, speeds recovery after a heart attack, and even reduces symptoms of the coronary artery disease. Now, of course, if you do have coronary artery disease, that exertion can sometimes make you feel that pain. So again, you're going to want to work with someone who can kind of give you a better idea of what level of activity should you be doing, and what else should you be doing to help support your heart if you are feeling that angina during that exercise. Okay, so that is part one. Just to recap, make sure that you understand this flow of blood sufficiently through the different structures within your heart. After you feel good about that, then you can utilize the 5 videos that are posted on Canvas.